Hi everybody, today I want to talk about one of the most important cornerstones of health, which is sleep. Because during our sleep, important functions take place in the brain and in our bodies. First of all, the brain neurochemistry during sleep, the things that happen chemically are very important to the nervous system and the hormone regulation system, as well as what happens in the muscle and fat tissue in your body at night. So optimal amount of sleep is between 6 and 8 hours. Some people get less or more than that, or need less or more than that, but that's optimal. You don't want to have too much. You don't want to have too little. Some of the problems that can be exacerbated by lack of sleep or deprivation of sleep are, trying to lose weight or, have balanced blood sugar, because what happens, the hormone regulation gets disrupted if you're not getting enough sleep. And the hormones that tell you when you're full or when you're hungry are off balance. So that's a very important aspect why we want to get sleep. Also, the brain neurochemistry at night for your nervous system and your mood, your concentration level, your memory, all those things are important. If you're not getting enough sleep, you're not going to be in a good mood. You're not going to be able to focus. You're not going to remember things. So it becomes a cycle. Then one becomes more anxious because they're not getting enough sleep, and we all know that story. So here's some tips and suggestions on how to get better sleep and how to get better sleep so that you can feel better and that your body works at an optimum level. Some of the major things that are suggested are to have a routine or a ritual every night before you go to sleep. And also to go to sleep at the same time and wake at the same time every day. Not different because you're not working. This will keep your circadian rhythm normal and natural. So first, what you want to do is you want to wind down from all the stimulus that is computers, TVs, eating, drinking. If you're really having a lot of trouble sleeping, they say that you should cut out all caffeine and sugar. I know it's very hard for me as well as most people to do, but if you really can't sleep, then that's where you should start. And then some things that are very helpful for sleep, and these are just suggestions, and you should always talk to your doctor or your healthcare practitioner before you do anything. But taking a warm bath at night in Epsom salt with different aromatherapy, essential oils is very helpful. Actually drinking, warm milk, because it is relaxing. There's certain supplements and amino acids that are very helpful. Magnesium, usually taken with calcium, is one of the major ones because it helps relax the nervous system and relax the blood vessels. And one of the theories of why your body needs to be more relaxed is because your blood needs to be more oxygenated to do these things that happen during the night. So that's about your blood pressure being lower and your body being in a more relaxed state. Some of the other natural remedies that people do, of course, are valerian root, passion flower, kava kava, and melatonin. Those are just a few of these things that you can do. You should talk to somebody about it, know what's good. There's the different ranges and different suggestions of how much and the amounts. But one of the things that's suggested by the experts is to not use the same remedy every night, because your body will get used to it. So you can I would start out with using one remedy, starting with melatonin. And there's a range. I'm not saying that I like melatonin the best. That's not what I'm saying. But you could start with one thing and see how that works. And you want to take the least amount of something to maximize the effect in your system. There are points in our life when things are really rough and even the natural things aren't working, and that's when you really need to talk to your doctor. And if it's a time when you need to take something stronger than these natural remedies for a short period of time or in limited dosages, but that should be a last resort, because that can mess up the natural rhythm of your sleep and cause other problems. But, sometimes you got to do what you got to do. The main thing is that you shoot for, most of the time, getting between 6 to 8 hours of sleep. The other thing that's important is your bedroom environment. You shouldn't be watching TV, you shouldn't be studying, you shouldn't be working in your bedroom. You need to have the appropriate amount of darkness, which is dark, to block out the light, the appropriate temperature, which is between 60 and 68 degrees. Any hotter than that can, disturb your sleep or keep you awake. If you have a problem waking up during the night and urinating, which happens if you drink too late at night or eat too late at night, those things are, just common sense things that we can't always do exactly at the right time. But if you can stop drinking about an hour before you go to sleep, that would be great. And not eat at least 3 hours before you go to sleep, that also would be helpful. So a lot of the major diseases can be prevented by getting good sleep, and that's diabetes, heart disease, cancer, and just feeling, good, anxiety, depression, and last but not least, acupuncture is something that can be very helpful for sleep and for calming your nervous system and regulating your hormones. So if you're a woman that's going through perimenopause or menopause or postmenopause, acupuncture is something that's very helpful. Or if you're just going through stress, which everyone is these days, acupuncture and also Chinese medicine and herbs are very helpful. But I've tried to give you some things that you can do on your own. So I'd say regularity, darkness, coolness, and relaxation, breathing, yoga, meditation. Pick one or two things that are really going to relax you before you go to sleep. White noise is also very helpful. The sound of the ocean or the sound of nature. So here's to your good sleep. Sweet dreams, and until next time, take care.